This is your concise guide on all the new changes mentioned in the 9th edition of NRP. So firstly, the chord management plan has now been included in the algorithm itself so as to emphasize its importance. Secondly, when it comes to delayed chord clamping, the previous edition mentioned 30 to 60 seconds, whereas this edition has kept it more specific to 60 seconds. When it comes to umbilical cord milking, this edition has said that in late preterm infants, that is between 35 to 42 weeks, who are non-vigorous and delayed cord clamping cannot be practiced, in such infants, umbilical cord milking can be a reasonable alternative rather than early cord clamping. The other change has been a terminology change. In this edition, the word positive pressure ventilation is replaced to the word ventilation so as to encompass all the forms of oxygen delivery such as TP, CPAP, endotracheal tube. There have been certain key changes to the target levels. So firstly, when it comes to the target saturation at 1 minute, that has been removed in this edition. This is keeping in view of practical reality. So now you know that when you connect a pulse oximeter, it takes a few seconds, almost half a minute, for it to register and the waves to come. So keeping in view of that, the 1 minute target saturation has been now removed. When it comes to FiO2, this edition states that in infants less than 32 weeks, a FiO2 of greater than 30% can be given if the situation demands it. This is again keeping in view of the data which was garnered from net motion studies. You can look it up. The other thing is that the peak inflatory pressure, this edition gives gestational age specific limits for the peak inflatory pressure. The last thing is the ventilatory rate. So the previous edition mentioned the ventilatory rate to be 40 to 60. This edition states that it can be 30 to 60. This is again practical because imagine you're giving chest compressions with ventilation. The ventilatory rate is automatically 30 per minute. There are few more changes. The ventilatory corrective step, which we remember as MR SOPA, earlier it was said that it should be initiated after 15 seconds. This edition says a cutoff of 15 to 30 seconds to initiate it. The other important thing is that the earlier edition stressed upon the order of MR SOPA, but this edition says that the actions can be performed in any order as per the judgment of the clinician who is performing the resuscitation. The other important change is that finally the laryngeal mask airway, the LMA, has been included in the NRP as an alternate to the endotracheal. The size of the endotracheal tube, the weight cutoffs have been changed in this edition. And furthermore, in infants less than 800 grams, this edition mentions that a tube of 2.0, if available, can be used. The depth of ET tube insertion, earlier it used to be measured from the tip to the lips. Now it mentions tip to the gums because gum is a more and easier structure to measure rather than the lips. Furthermore, I am putting this illustration with due credit so that all the changes can be visualized at a glance. The other thing, if you're interested, is that this edition of NRP also includes supplements which stresses on NRP in specific situations such as neonatal resuscitation outside the hospital, neonatal resuscitation inside the NICU, as well as NRP for a suspected cardiac disease. So if you're interested, do check out the entire document on NRP. But these are the key changes which you need to remember for your exams as well as practical life.